Each year, the cost of doctor visits, procedures, and insurance continues to climb. A new book explores how to make American healthcare cheaper and better.
Robert and Jim Revitzer are the authors of Why Not Better and Cheaper, Healthcare and Innovation. James and Robert join us this morning. Good morning.
Good morning.
Good morning.
I just want to make sure we can see you. There
we
you are.
go.
Great. Wow, you guys look a little bit alike. You're adding some whimsy to this serious discussion about healthcare. Thank you.
We're identical twins.
Yeah.
And what are the odds, both of you, did you in your own fields manage to be in healthcare? Did that happen by accident?
We never stop talking to each other. That's the problem. And so we influence each other. What he's interested in, I like to do. What he likes to do, I like to do. So we kind of shaped each other a little bit.
But
we don't do exactly the same thing.
Yeah.
Uh-huh.
I wonder if the criticism of better, cheaper, healthcare is, hey, if you start putting guardrails on cost, America is not going to have the best drugs and not going to have the best procedures. What would your response to that be?
Well, that's why we focus the book on innovation. We think innovation is the key to making healthcare both better and cheaper. And our book is about why doesn't healthcare get better and cheaper like the cell phones we have in our pockets? And our answer is it's too easy to make money with low value innovations and too hard to make money with innovations that reduce cost. And that's what we write about in the book.
But does that imply that the government needs to step in and sort of fix this? Or, otherwise you're just, begging these private companies to maybe change their values?
We think the solution should focus on incentives, and that's a big part of the solution, and also making markets work better too. So yeah, government plays a role, and private sector plays a role in responding to the incentives.
And so too do the norms of the profession, orienting the training of physicians and other providers around the problem of innovation, and being good social stewards of social resources.
So you say innovation. So I think we all kind of assume that someone out there is working on, curing cancer. Someone's doing this. Are you saying there's not enough money going into big projects? Is it because of patent issues? What's the big holdup?
Well, maybe I could tell a quick story. Antibiotics ought to be new antibiotics ought to be a great business, right?
Right.
Bugs are constantly evolving and needing new drugs to deal with them. But it turns out it's a really bad business, and it has to do with the way the incentives work in patents. When you make a new antibiotic, you want to hold it in reserve until you need it when the new bugs arise. And if you do that, you kind of eat into your patent exclusive time. And that means that it's less attractive. And so right now, only about 4 companies are working on new antibiotics. And that's something we all need.
Can you give us some specific examples of treatments and or tests that are perhaps too expensive and not needed?
There's a great website called Choosing Wisely that has a list of 500 such treatments.
Wow. And
you can go onto it, and it's a collaboration with a consumer organization and many professional societies. And so they give you a great list of, depending what your issue is, what's a low value treatment.
So James, what do you say people do in the meantime? You're kind of stuck between a rock and a hard place. You need health care, you got to pay for it. Is there some way to work it so you're not paying as much?
Well, we're saying that the way to do that is to try to get the kind of innovations that deliver better care at lower cost. And the way to do that is to try to reform the patent system, change the incentives, make hospital markets more competitive.
What about on the insurance side? Insurance companies, I imagine they pay millions of dollars for marketing. I don't know that in countries that have socialized medicine, there's a need for that.
I think that what we have is both on the insurance side and the provider side, we've got a small number of companies providing a lot of the services in most parts of the United States, and that's bad for competition and probably bad for prices and consumers.
Wow. Well, you can check out Revitzers.com, and there's their social media addresses on your screen. The book is Why Not Better and Cheaper, Healthcare and Innovation. Thank you, James and Robert, for being with us.
Thanks, guys.
Thank you.
Bye-bye.